So hello all, I'm Priyanka, and I'm a radiologist specializing in breast imaging, and I would like to talk to you all about breast cancer, how prevalent it is these days, how we can screen for it, and what's the next step. So as a radiologist, basically, what's my role in that? So let's see, who gets breast cancer? The answer is anyone. And not just women, even men get breast cancer. Not many people know about that. Young, old, women, Asian, African Caribbean, African American, white, Latin, every race of women are not spared, unfortunately. There are some other facts which I would like to highlight. Older women are more likely to get breast cancer. However, if younger women get breast cancer before the age of 40 or premenopausal, it's way more aggressive. And the prognosis and the treatment, the prognosis is less better in comparison to the older women, and the treatment has to be more aggressive too. So although it is less common, younger women in their 20s and 30s do get breast cancer. Also, according to statistics by American College of Radiology, white women are more likely to get breast cancer than other racial or ethnic groups. However, African American or African Caribbean women tend to have more aggressive type of breast cancer, unfortunately. So younger women or African American, African Caribbean women have more aggressive cancer, although white women have more commonly breast cancer. So other fact is men can also get breast cancer. 1 in 100 cases are seen in men. I've seen plenty of them myself, and they do have family history in their sister or in their mother, so that's one of the facts we should know. Breast cancer is second only to lung cancer as a cause of cancer deaths in women. As for the recent statistics, 1 out of every 8 women will be diagnosed with breast cancer in 2015, which is quite common, 1 in every 8. In 1970s, the rate was 1 out of every 10. So the rate is going up. It could be lifestyle, it could be environmental factors, which we really don't know about yet, all of them. So we're going to talk about risk factors. Race, we just talked about. Early age of menarche. Early age of starting of menstrual cycle exposes the breast to more estrogen hormone, and that may increase their predisposition to get breast cancer. Family history of breast cancer plays an increased role in developing breast cancer. If the patient or women don't have children, that increases the estrogen amount or the estrogen in the blood to which breasts are exposed, so that increases the risk as well. Postmenopausal hormone replacement therapy, again, hormone. Oral contraceptive use, again, hormones. Genetic predisposition. A lot of people might have heard about Angelina Jolie getting tested for BRCA. She was positive for BRCA, so she chose to undergo bilateral mastectomy, which I feel was a good decision, because if you are tested for BRCA and you're positive for BRCA1 gene or BRCA2 gene, you have 80% chance of getting breast cancer in your lifetime, which is quite high. So her choosing to do what she did was a good thing. After that, there was a surge of mastectomies all over the United States because it's Angelina Jolie. Other thing is lifestyle. Increased alcohol intake, increased body mass index, overweight, obesity. Those are one of the contributory factors towards development of breast cancer. So we're going to also talk about signs and symptoms. So as primary care physicians and as patients yourself or as women yourself, what are the most common signs and symptoms for breast cancer? First would be a lump. If you feel a lump, and they're mostly painless, so they're like silent killers. So lump, most common. Other could be a discharge from the nipple. If you hear a woman complaining of one-sided discharge, either clear or bloody or blood tinged, those are the buzzwords. You've got to work this out. You got to not let this go. If I hear a woman telling me, well, I have milky discharge, I have green color discharge, yellow discharge, that does not worry me that much, because a dilated duct or sometimes papillomas can cause yellowish green or milky discharge. I know it sounds gross, I'm sorry. But unilateral discharge, clear discharge, blood-tinged discharge, or bloody discharge from one side of the breast, buzzwords and all, we need to work it out, okay? Change in size or contour of the breast. Sometimes I have seen women come to me with extensive breast cancer. The size of the side which has breast cancer is much more smaller than the other side. So breasts actually do retract or shrink. Why? Because breast is held by Cooper ligaments, and cancer cells just kind of involve the Cooper ligaments and kind of pulls it back. So the side which is involved may actually appear smaller than the other side, which is another feature we look on the mammograms. Nipple inversion. If a female says, well, my nipples have always been inverted since birth and it's bilateral, fine, I'm not worried. However, if it's a new finding, she got a new nipple inversion, it's only a few months ago, this is something suspicious, so we need to work on that. Change in appearance of areola, if you heard of Paget's disease of the nipple, that may cause crusting, redness, erythema of the nipple and areolar complex. Redness or pitting of the skin over the breast, and it looks like orange peel appearance. I don't know, in French they could poudre orange, I'm bad at that pronunciation, I'll just say orange peel appearance on the breast. Yeah, that's actually one of the signs of inflammatory breast cancers, and that's one of the advanced stage of breast cancer. We do not want to see patients in that stage. We want to catch them way before that. So what do we do? So what exactly, as a radiologist, I do? I'm not a technician who shoots the mammogram, and I'm not a nurse. I am one of the radiologists. A lot of people don't understand that, but I'm the radiologist who looks at the mammogram. And what's a mammogram? I had a patient come to me saying, I need an angiogram. And I said, I'm sorry, I cannot offer you that. So yeah, what exactly is a mammogram? It's basically just a simple x-ray with much lower dose of radiation to examine the breast. If you see the image, the breasts are placed in between two petals. I'm sorry, there is a compression applied to the breast. It is uncomfortable, sometimes painful to the females. Sometimes they do not cooperate, but most of them do. And it's very useful. So mammography basically takes an X-ray picture of both breasts. It can show changes in the breast up to 2 years before the physicians can actually feel it, which is what we want to do. That's our goal. We want to catch it before it becomes too big. So this is what I'm looking at. You see this gray-white kind of picture. This is a very nice, smooth, circumscribed, oval, well-delineated mass. It is something which does not bother me because it's a benign-looking mass. However, here, if you see, there is just some like grain of salt, calcium kind of appearance, that bothers me. So these are microcalcifications which may be present in malignancies. And there are types of calcifications which we have to look for to find if there are any early stage of, or we call it ductal carcinoma in situ, or early non-invasive type of cancer. So these are the things we're looking. We're looking for masses, we're looking for architectural distortion, we're looking for calcifications, and they look like tiny flecks of grains of salt, okay? All right, so just to show you an appearance, this is an irregular, indistinct, irregular mass kind of thing, which would concern me. It was a biopsy-proven malignant mass. However, this, which is well circumscribed, smooth, well marginated, that's a benign mass. Now, breast could be different densities. If it's an extremely dense breast, which is here, you see a lot of white cloud-like appearance, that's dense breast. And to see through them, it's not easy. This white cloud could be hiding a cancer, a mass, a cyst, I don't know. So what we do is, for dense breast, we have to supplement dense breast screening mammogram with ultrasound, because ultrasound really helps in dense breast to pick up the masses or any invasive cancers. Extremely dense, cancer can be difficult. The fibroglandular tissue, which is all this white tissue here, may hide the tumor, and we supplement it with ultrasound. Now this is a fatty breast. As a radiologist, I love fat. I love it because you can can see through it. You can see a mass. You can see calcifications. Dense breast, it's hard to see. I'm not saying that's good for my patient, but it makes my job easier. So it's easier to detect cancer in this type of breast tissue. Now we have what we call a 3D mammogram, or medically we call it tomosynthesis. It's basically a next generation or the newer version of mammogram, and we use it on almost all our patients. So I just want to show it to you. There's no sound. Uh-oh.